Dr. Pittaway, let's talk about sleep apnea. You know, the snoring, they're not getting enough oxygen and stuff. And there are many methods to fix it. And a dentist is one person who can fix and help out with that area. Talk about it.
Well, Helmut, that's a great question. Sleep apnea is when people can't breathe properly at night because their airway collapses. And so they stop breathing for sometimes up to a minute almost, until their brain kicks in and they have a big, great snort, and they wake up or they start breathing again, and then it keeps happening over and over again. This puts a strain on their heart and their lungs. They don't get rest. Many of them seek medical attention for it and are diagnosed with sleep apnea through a sleep study where they put the electrodes on your head and watch you all night. Well, it's a big problem for many people, either due to anatomy or perhaps weight adds to the problem. And the most common...
Did you just say weight adds to the problem? Overweight people have that more likely than underweight people?
Well, yes, it's true, but underweight people have it as well if they have a long, soft palate. One of the most commonly used treatments is called a CPAP, which is a continuous positive pressure airway, where they put a big mask and an oxygen hose and you strap it on your head like a gas mask, and try to sleep with this thing, pumping air into your face. It works okay for some people and they get a lot of rest and it's very beneficial. It protects their heart, but a lot of people don't like those. They will rip them off in their sleep and don't even know they do it, and so they don't get the benefit of it, or it's uncomfortable and they can't tolerate it. So the dentist now is able to provide a couple alternatives that still give you the benefits of the treatment in a more comfortable way. And some of these are dental appliances, based on a mouth guard that will hold the lower jaw forward to open the airway a little bit. And if you still need the oxygen or the airway pressure, we have something called an OPAP, which just looks like this. And it's an upper and lower mouth guard. It's joined together, and it has the air comes in this end, and it blows out this end here.
Interesting.
Up through the roof of the mouth. And there's no straps. It fits right in the mouth. It's very comfortable. And I've had patients who are just so excited to be able to get some sleep, sleep in the same room with their spouse for a change. The quality of life goes up. They get rest. They perform better during the day. And they don't have to put up with that straps and the mask. And they can even turn the air pump down quite a bit because it's so effective. We're trying to work with the doctors in our area so that their patients who can't tolerate the mask and the gas mask can get the benefit of this appliance so that they can help their patients sleep better and just lead better lives.
Wow, that's interesting. It reminds me of a little story, maybe about 5-7 years ago or so. I had this little discussion with this exercise sports kind of teacher, whatever, guru. And I said, there's always this service out, which is the best exercise you can do. And so I thought I asked him that question, and I said, sir, what's the best, most healthy exercise a person could and should do? He looks at me and he says, Helmut, the best exercise is the one you will do. And that made so much sense to me because, if you, I used to, for instance, bicycle, and I say bicycling is a good exercise. Anyway, today, I just probably won't do it anymore for whatever reason. The way I live in Los Angeles, I don't want to run around those streets with those trucks around and this other. It's not anymore what I do. So what you need to do is what you can and what you're willing to do. And I have heard, and tell me, whether that's, true, that yes, the oxygen mask is with no doubt the best, but only if you do it. So if you don't do it,
right,
and you get the second best, which is the appliance a dentist makes, whether it's 70% as good as the other one, but if you do it, it automatically becomes the best.
Well, Helmut, you're right. Actually, the appliances, for example, this type of appliance, combined with an upper one to hold the jaw is second best. The OPAP, in many cases, can actually be much better than the CPAP because it's more comfortable, it's more effective, and it's a thing that they will do. And so just like people ask me, what's the best kind of floss? I say, it's the kind you're going to use.
Right. Right. Yeah. Yeah, absolutely.
Right.
Absolutely. In fact, me being in business and I deal with people literally around the world, having traveled a while and whatever it may be, I hate it when the newspaper, I don't hate it, but like I smile at it in a degrading way, when the newspapers and the television list the 10 best profession in the next 10 years. Nothing could be more bullshit than that. Because the best profession is the one you like, you have your heart in it, you love to do. I mean, you can be the lowest level gardener and make $1 million if you love it, and you will just hire 400 gardeners, high school kids, illegal aliens, who cares? You'll make lots of money if you like it. You understand? At the same token, you can not like certain things and have a PhD and you'll be just miserable even if you make a little bit of money, and quite often because of it all shit will happen and you usually won't make money. So anyway, it's what you can do is the story. And by the way, one small action on that OPEX, on that that thing which could possibly be the best. Is that I missed that. Is that still hooked up to a hose with oxygen pressured in or not?
Well, yes. The people who use the CPAP machine have a machine that pumps the air and forces it in and out of their lungs so that they don't stop breathing at night. And you can replace the hose from that unit onto this unit right here, and the air comes right out the back and down into your lungs. It works extremely well and doesn't dry you out in the nose as much as the other ones do. But it is an actual air pump that keeps it going and prevents the stopping of breathing that's so dangerous.
Right. But you still do with that because you have a hose. You still have the problem with tossing and turning. There's only so much tossing and turning you can do with that thing on it, right?
Well, I think you need to be a little careful, but it's much more comfortable than having straps all the way around the back of your head, the top of your head, and around your ears, and covering your nose and your mouth and your chin. Just like wearing a mouth guard on the top and bottom teeth in a comfortable position. So most people tolerate it much better, especially if they can't get a good seal with the air from the other one or if it gives them trouble. Right.
So we talked about 3 ways to a degree. The air mask, super good if you can stand it, and the mouth guard by itself, quite good because it does the job and it's quite easy to wear. That's not a problem to wear. And then you have the hybrid in between where it's a little more difficult to wear but easier to wear than the air mask, and yet it also gives you the air. And I guess people can just, you can make them probably both of them if they want to go for the air mask and get the other one. So if they are tired of having the OPEC one, they can put at least the normal one in it, right?
Yeah, well, we work with the physician to get the air tuned in just right and figure out what works best for you so you get the most benefit from the treatment, and it's very important for some people to have the treatment because they're a great risk for heart attacks, brain damage. I mean, you got to breathe, and they stop breathing in their sleep for sometimes over a minute.
Yeah. Well, while there is, I think, not too much, at least measured evidence, one doesn't know that people, really did die. But let me ask you, if you have that problem that every few minutes you don't breathe as much as you want, is there a chance that you wake up more exhausted and tired than you should, that you don't get your night's sleep, and that makes you that makes your day, well, you're exhausted. And being exhausted, again, that triggers a load of other problems throughout the day.
That's it. That's exactly right. People are tired. They wake up tired. They're tired all day. They try to get sleep. They actually sometimes spend more time in bed than other people trying to get their rest. But they're tired. They're tired all the time. They wake up tired, and they have no energy. They don't perform well. The other bad effects of the sleep apnea can be enlargement of the heart. It stresses your other organs. And when you get your air flowing in your night's sleep, it's a whole new person. It's a wonderful thing.
I'm sure all of us had some type of outside example of that, you know, if we didn't sleep for too long, too well, and then we finally got a good night's rest, that we felt, you know, new. And, so wonderful. So again, there is a sleeping, a dimmer switch, long-term effect which comes so slow that you don't notice it, that, you know, over years and years you just got, again, more worn out because you never really get the type of sleep you should get. And on top of it, you don't know it. So it becomes a camouflaged hole and you're not looking for it.
Yeah, many people aren't aware of the problem, and other symptoms will start to make the doctor wonder. They'll ask the right questions and prescribe a sleep study. Of course, nothing can be done about having kids. They keep you up at night too, but I haven't solved that one yet.
You mean you haven't invented a gagging, instrument, something which gags them and kind of like knocks them out or something?
As far as I know, the best thing is a good bedtime story.
Okay, well, wonderful. And you're an expert of it because I do know you have a bunch of them. How many you have?
Only 6 girls in my house right now.
Well, wonderful. Does that include your wife, or is that the 7th?
She's number 7.
She's number 7. Well, thanks a lot, Dr. Pittaway. Bye-bye.